Hi, this is Kamil from Delrade Wellbeing, and today I'm going to discuss lower back pain, and I want to give you some tips on lower back pain. So, if you injure your back, it's just happened, and you probably feel some seizures, or maybe it's seized and you hardly move. Then you need the rest. First of all, you need the rest, and you don't want to move it too hard or too much. It just needs rest, and it needs to stay fixed, relatively fixed, at least for a day or two. It's probably inflamed, so last thing what you want is hot water or any kind of hot water bottle or hot bath, nothing like that. At this stage, ideally, is actually start to put some ice packs. Your muscles might not like it completely. They might a little bit spasm or something, but you only use the ice pack for 5 minutes at a time, maybe 5 times a day, and you put it between your t-shirt and your trousers. So it's not directly on the skin, but it's through the t-shirt. And the idea is obviously reduce inflammation, because when the back is injured, there is possibility that it's swollen and it's swelling up. So you want to reduce that swelling and that inflammation. Another thing is whether to take painkillers or not. I would say don't take painkillers during a day, but you can take painkillers at night just before you go to bed, because you want to be able to sleep, and it will reduce the pain during the night. And you certainly need a good sleep, and you need to recover. So painkillers only for the night. Now, let me a little bit explain why is it important to fix and to stabilize and protect your back in place. So your back has slight lordosis, slight arch on your back, which is good. And you want to maintain that slight arch when you do your stretches, when you do your exercises. You want to keep that position natural, and that is in the arch. What you don't want to do is something like child pose or knee tuck, where you're rounding your back. Because when you're rounding your back, you actually bulging the disc out, and actually you might feel a little bit of release because it opens up and the swelling can finally go somewhere. But when you come back, you might feel even worse. So it's not recommended to do these knee tucks or any kind of bending around in your back, because you want to keep it in a slight arch. So all the exercises which I showed in the other video are done from this neutral position, whether it's stretches, whether it's exercises. So at this stage, when it just happened and for another week, you want to make sure that it's fixed, that it's protected, and it's in place in the right, correct position. And lastly, you can start to strengthening the area by exercises for your core. So you want to certainly address your core strength, and you want to certainly do some stretches around the area, especially around the hips area, which they all obviously working together and support your back. So just to summarize, we don't want to take painkillers during a day. We want to take them only in the evening when you need a good night's sleep. Secondly, you want to fix your back. You don't want to twist it, turn it, rotate, especially not rounding your back and so on. You want to just slightly mobilize. We're talking 20-30% of movement, very tiny bit, but never go into extremes, never go to the limits. Cold exposure. So you got ice packs for 5 minutes maximum through the t-shirt, and you can repeat that 5 times a day.